Hi, I'm Congressman RUiz. I grew up in a small desert town in California. Most of the people in my community couldn't afford health care, and I saw firsthand how much they and their families suffered. So I made it my life's mission to help people get better access to the medical treatment they need. I became an emergency physician. I've taken care of a lot of people with serious medical needs, people of every age, every income, and every walk of life. So I understand the healthcare system from the inside. In the ER, we work as a team to do what's best for our patients. We look at the situation, study the facts, and we use the best science to decide what treatment is best for our patients. Now that I'm in Congress, I work the same way, because policy should be based on facts and science, not on ideology, partisanship, or alternative facts. Today, I'm going to talk about the Republican plan to repeal the Affordable Care Act. Their plan goes by several different names. Some people call it the American Health Care Act, others call it Trump Care, some call it Trump Doesn't Care. But based on the facts, I call it the Pay More, Get Less Health Care Act. Recently, Donald Trump said this about health care.
It's an unbelievably complex subject. Nobody knew that health care could be so complicated.
Actually, anyone who's ever applied for insurance or who tried to figure out their hospital bill or who struggled to provide health coverage for their employees, they knew. So basically, everybody knew. Healthcare is complicated, which makes it even more important that health policy be based on facts and evidence and that we listen to the experts. Fortunately, there are a lot of nonpartisan healthcare and budget experts who have collected a lot of evidence. Some are Democrats, some are Republicans, but they all put evidence ahead of ideology. So what does the evidence say the Republican plan would do? Just recently, the Nonpartisan Congressional Budget Office, which, by the way, is run by a Republican, gave us the answer. Millions of Americans will lose their health coverage. Older Americans will face skyrocketing premiums just when their need for health care is greatest. And big corporations and the wealthiest Americans will receive a $600 billion tax cut. So let's talk about that coverage first. In his recent show about this bill, Paul Ryan said this.
We passed this law, and the day after, Americans who have insurance aren't going to lose it the day after.
Technically, he's right. It won't be the day after, but millions will lose their care a few months after. According to the Congressional Budget Office, 14 million Americans will lose their health care by the next year, and 24 million will lose their health care within a decade. As a doctor, I've seen what happens when a person with asthma or diabetes or cancer can't get the care they need. Their illness gets worse, the cost of treating them goes up, and most importantly, our ability to treat them declines. People will die, and everyone will pay higher costs. So now, let's talk about those higher costs. Again, the evidence is clear. The Trump-Ryan plan is really an age tax that forces older Americans to spend thousands of dollars more on health care. According to the Congressional Budget Office, a 64-year-old making $26,500 a year now pays less than $2,000 for health insurance on the individual market. Under the Republican plan, that would increase sevenfold to $14,600 a year. So that person would spend more than half of his or her income on medical insurance, leaving only a little for food, housing, and other necessities. Millions of Americans, including maybe you or someone you love, will have to choose between purchasing food or buying health insurance. Finally, let's talk about that $600 billion tax cut. Raise your hand if you think big corporations and millionaires deserve tax cuts. Okay, Mr. President, I see your hand. I see you too, Speaker Ryan, but not many others. A nonpartisan research group called the Tax Policy Center found that the wealthiest Americans will receive an average tax cut of $37,000 a year. $37,000. Their tax break is more than the entire annual salary of that 64-year-old I just talked about. That's not fair, and it's bad for America. Now, there's one more area where the Trump-Ryan bill hurts millions of Americans in the name of extreme partisan ideology. Their bill would end funding for Planned Parenthood. This has nothing to do with abortion. Planned Parenthood is already prohibited from using your tax dollars for abortions. No, this provision would end funding for 2.5 million people who receive health treatment and life-saving screenings from Planned Parenthood. Over and over, the Trump-Ryan bill puts ideology ahead of expertise. So I have some questions for President Trump and Speaker Ryan. The American Medical Association and the American Nurses Association say your bill will harm millions of Americans. President Trump and Speaker Ryan, do you think you know more about what's best for patients than do doctors and nurses? The American Hospital Association says your bill will make it even harder to provide essential treatment to the sick and injured. Do you think you know more about medical treatment than the hospitals that serve in our communities? The AARP says your bill will cost older Americans thousands of dollars in higher premiums and out-of-pocket costs. Do you really think you know more about what's best for seniors than AARP? What on earth are you thinking? Or do you just not care? Paul Ryan likes to talk about forcing patients to have skin in the game. He thinks that if ordinary Americans feel the pain of paying more for their health care, they'll raise a stink about the cost of health care. You know what? I think you already have skin in the game. Your life is on the line. Your family's financial stability is at stake. What more does Paul Ryan want you to risk? But I do agree with him on one thing. You need to raise a stink. Make your voices heard. Call your representatives and say, this bill stinks. Tell them that they've got skin in the game, and if they vote for this bill, they're going to feel the pain. And this doctor won't be able to do anything to help with that kind of pain. I'm Dr. RUiz, and I approve this message.